That's new.
This
Nina,
is an interesting accent as well.
yeah. Nina, welcome to the podcast. It's an absolute pleasure to finally meet you, even if it's not in person.
It's wonderful to be here, Alex. Thank you for inviting me.
No, it's going to be a really good conversation. I think your background, your education, your journey is really quite inspiring. So that's probably a good place for us to start before we dive into today's topic. So are you happy just to share a little bit about you, what you're up to these days, and how you've got to where you are?
Sure. So I'm originally a scientist. So I studied natural sciences at Cambridge before I even studied nutrition. And then I went on to do the Institute for Optimum Nutrition diploma. And then medicine was actually my third degree. So what was interesting about the way that I went through medicine is, of course, I entered it with eyes wide open. So I kind of already went into all of this thinking about the pathology and pathophysiology and how we treat disease in a very broad view of understanding the science, but also understanding the impact that nutrition and lifestyle has on the way we live and how we get sick and how we recover. And then as I went through my medical training afterwards and worked in the NHS as a doctor, I then got breast cancer. And then I had to step back from my work for a little bit. I worked in nutrition, continued to work in nutrition for quite some time during that time anyway, but it was a time for me to reevaluate and to think a little bit about what do I really want to be doing? Because at that point, I was already feeling like I was leaving half my brain at home when I was going to work. Because with the best will in the world, we just can't deliver the nutrition and lifestyle medicine in NHS the way we want to sometimes. And it was really tricky to be in a system whereby we were doing so much firefighting and so much of the acute medicine things without actually changing people's long-term trajectory, which was a really tricky situation to be in when you're working yourself to the bone, doing all the shifts in the world and actually just seeing people bouncing out of hospital and you feeling like you're just stabilizing the acute situation barely and not really making any difference to the root causes. So during my time out, I sort of did more of my functional medicine nutrition work. I also did a qualification in integrative medicine and functional medicine health coaching. And when I returned to the NHS part-time, I kept going with my functional medicine practice alongside it. And then I acquired other qualifications. So I went and did herbal medicine. And then most recently, I also became a yoga and mindfulness teacher. So expanding my repertoire of things I could offer my patients. And eventually I kind of had enough, really. I love the NHS. I think it does an amazing job in being a public healthcare system. But ultimately, I didn't feel like I was really in a place where I could innovate and provide the integrative care I was really, really passionate about. So then I left and set up Synthesis Clinic, which is a multidisciplinary clinic where we specialize in complex women's health cases and multi-system cases and integrative cancer support.
Amazing. So yeah, I guess before maybe we dive into some of that, a conversation that I guess rather remarkably I haven't had yet with a guest is kind of a brief discussion around the differences between, let's say, a conventional medicine mindset and a more integrative functional medicine mindset. So are there any I guess big concepts that we can just touch on now to help people just understand that difference?
Sure. I think with conventional medicine, we're still in a way practicing acute medicine in the chronic disease world. And I think that's where we run into trouble. So quite often the conversations that we have in conventional medicines are about you've got symptom A, you've got disease B, and you've got drug C. And it's a kind of relatively linear pathway. And the problem is that every single different symptom or every single different disease gets treated with a different drug, and therefore it's very easy to run into something called polypharmacy, where people end up on multiple medications. And what we are not doing really is looking at what's behind those diseases. Is there a unifying pathophysiological mechanism that's driving it, like chronic inflammation being driven by whatever is driving that, instead of just keeping people on more and more drugs. So quite often what happens in conventional medicine is that you go to see your doctor for your high cholesterol, the doctor will give you a statin for your high cholesterol. And quite often we just don't have medical training to be able to deliver lifestyle medicine. So you don't get given any lifestyle advice beyond eat a balanced diet, which, as we know, is really non-advice. And then a couple of years later, because we haven't really sorted anything out in terms of nutrition and lifestyle and some of the drivers that might be driving that metabolic disorder, you will go, okay, and now I've got high blood pressure. So then you acquire a second medication. And a few years later, there'll be diabetes, for example. So you end up with people being on, you know, I think 10, 20 drugs. And I'm not even kidding about 20 drugs. By the time I sometimes see them in hospital, you know, when they're 65 and 70. And the problem with that is, of course, then that becomes counterproductive, because really what ideally we should be doing is actually doing root cause medicines, looking at the root causes, identifying those, treating those as early as possible, and doing a much more preventative medicine, so that we are not actually firefighting at the other end of the spectrum when people have fallen off the cliff completely, and then trying to put them back together is much, much harder to do. And of course, places a huge burden on the NHS, both financially in terms of staffing, and also ultimately decreases the patient's health span so much and affects their individual well-being in a significant degree. I think, you know, ultimately medicine, when it was designed first, NHS, when it was designed first by Bevan, was very much an acute service, right? You came in with your acute problem, you got it solved. You know, if you got a broken leg, if you had an infection, had a problem post-war, you got it done, you got it sorted, you got sent home. The problem is this strategy just doesn't work very easily for us right now, because chronic disease is a multifactorial interaction between sort of genes and environment that happens in a not a nice, neat ABC type way. And therefore, using the same kind of approach, same kind of thinking doesn't really work. And we can see that from the chronic disease epidemic that's going on right now. So I think it's about shifting our mindset from saying, okay, well, we've now become, we can't use the ABC model of symptom, disease, drug. We need to think in chronic disease, what are the drivers? What are the nutrition, lifestyle, exposome drivers for some of those in really complex disorders? And then can we address them early? Can we do preventative care? Can we support medication with using nutrition lifestyle? So we use the minimum amount of medication necessary for the minimum amount of time necessary, and increasing the health span of our population, rather than just trying to do the survival bit, which is what it seems like we're doing at the moment in the service.
Yeah, I think that's a beautiful explanation ultimately, in this idea of what's driving the pathophysiology, or as you gave the example of the inflammation, is, I guess, one of those key principles, which takes me to that saying, and certainly the functional medicine world, of treat the individual, not the disease. And I think I find that a really kind of liberating and empowering kind of concept ultimately, because it means that I don't have to know the protocol for condition X or whatever it may be. You can actually use your own logical thinking to some degree to understand what is the path that we need to go down here.
Absolutely. But I think the other thing that we sometimes run into is the fact that medicine has become quite protocolized. So when we start thinking about talking to our conventional medicine colleagues, you know, ultimately protocols aren't really a bad thing in of themselves. They try and standardize medical care. So that's but the inflexibility that comes with protocols and guidelines is a problem, because ultimately we still need to use our medical minds and our individual clinical assessment, and also practice a much broader view of evidence-based medicine that what is being portrayed to be in recent years. In recent years, it's all been evidence-based medicine. It's all about randomized controlled trials. And this is it. This is the best kind of evidence, and we're done. And actually, the original conception of evidence-based medicine is very much based on a three-part model, which means, yes, take the best available clinical evidence out there, but also take clinician expertise and patient preferences into account. And that is really truly evidence-based medicine that is rooted in patient care and patient experience, rather than us trying to force a model that doesn't fit.
Yeah. Okay. And is there anything that, to kind of touch on from a, I guess, sort of a testing perspective, because that's a big area that certainly I've seen a few conversations around, and I think there's sometimes questions and to some degree, from my sort of experience, frustration that there is some of this testing out there, but it's not necessarily easily accessible.
Mm. I think we have to realize that in the NHS, we have a publicly funded health service, which is designed to do the basic acute care and provide the best care to the largest amount of population possible. Unfortunately, that does mean that when we're treating the common denominator, it does mean that complex patients and patients who have complex needs or needs that are outside of that spectrum are not going to necessarily always get the care they need. And we have to acknowledge the limitations in NHS. I mean, to be honest, we're struggling with delivering basic care in NHS right now, let alone anything a bit more complex.
Mm.
And the education also plays a role in that. As you and I know, Alex, you know, we would get a lot of training in the gut microbiome as we went through nutrition and functional medicine training. But I didn't even hear about the gut microbiome when I had my Cambridge medical training. It wasn't a part of the story. And you think, okay, well, this is a leading top medical university, surely. And they're actually doing research within that setting. But we just doesn't filter down to the medics because there isn't an easy drug at the end of it. Okay, I guess the closest we can come to a drug within that setting is FMT, the fecal microbiome transplant, which is a stuff that quite often people go to.
Mm.
So I think we've got to recognize that, yes, there will be complex testing that will be required for complex cases. We cannot expect the NHS to provide it. And at that point, we might need to seek other providers, but also with the ability to follow that up. Because as we know, it's not as important to get just a test. It's how do you interpret those results in a very sensible way?
Mm.
And also how do you then personalize the plan based on those results?
Yeah, brilliant. So, how is best, do you feel, to kind of navigate this into, I guess, sort of using your experience and speciality now in regards to sort of complex conditions with women and cancer and integrative care? I'm going to put the ball in
Well,
your court.
let's start with I guess the broad view and the way that conventional medicine treats certain things. And
Okay.
it's not about bashing conventional medicine. You know, I'm extremely grateful for all the medical advances we have, and I think it can do an amazing job. I think that the problem is when you just use one lens, which conventional medicine is just one way of viewing the world and disease, and we forget to use deep physiology, actually, because again, medics forget that they get taught it in the first year of medical school, and then we almost forget it, and this all becomes about kind of drugs and pathology and identifying and diagnosing disease. So it's about, for me, taking conventional medicine and integrating it with the best of nutrition, lifestyle medicine, and other approaches, adjunctive approaches from mind-body medicine or evidence-based complementary medicine, to make sure that we are doing the best for the person in front of us. And I think that's a different way of using care. It's not about one or the other. It's about taking the best of all worlds. And to me, this is what integrative medicine is and what it should be. It's not about just doing green pharmacy either. So just about substituting pharmaceutical protocols for supplement protocols. Because guess what? That still doesn't really solve the root problem. We need to be actually looking a lot deeper. And what we can do in clinic with using integrative medicine and functional medicine as a lens is looking at really complex cases that have 20 symptoms, 5 diagnoses, and like you said, even stuff you might not know about, and go, okay, you know what, I've got a framework with which to start with. I can assess someone as the whole of their being. I can look at some of the underlying drivers, and I can look at how some of these underlying drivers might interact with each other, and use appropriate testing and then appropriate interventions to be able to get that person back into balance and back to their homeostasis.
Perfect. So you mentioned, I mean, you mentioned also off air some of the factors that we might need to consider, some of these underlying imbalances that are driving the pathophysiology manifesting in the symptoms. So in your experience, what are some of, I guess, just the big drivers in the first place that if we're tuning in and listening to this conversation, that maybe we can kind of retrospectively think, you know, how does this apply to me in my kind of journey?
Sure. I think you always start with the beginning. You start with what are the predisposing factors for where someone's landed. And that includes things like family history, actually examining your family history. In complex women's health, we quite often find that if someone's got a significant, say, PCOS history, there may be that running through the family. If I see women with yeah, really young breast cancer, they may or may not have family history. It's quite interesting to discover whether there is something that we need to be looking at and investigating further. And then it's about also just looking at some of the setup that we have for life. And this is where, of course, the first 1,000 days in the gut microbiome comes in significantly. And so a lot of the things that when we used to see children in clinic as well, we used to certainly see that any early use of things like PPIs, so things like omeprazole or lansoprazole, any of those things, and other acid blockers in children combined with antibiotics could lead to a significant rise in allergic presentation later in life. So, and we can see this documented in literature now. There's been quite a lot of studies based on that. So thinking about looking after our gut microbiome, okay? So it's avoiding unnecessary antibiotics. They are absolutely sometimes necessary and we should be having them. I wouldn't want to lose a kidney due to a urinary tract infection, thank you very much. But there's also sometimes we also expect to be fixed by an antibiotic, where actually we just need to let our body have the time to recover from a viral infection rather than always having to have an antibiotic. And nutrition, of course, we think about the foundations of lifestyle, so examining that and having how that plays a role, because a lot of the chronic inflammation we see in the world can be driven from the nutrition lifestyle factors, as well as GI dysbiosis, as well as some of the other exposures we might be having at the time. So actually thinking, are you having a whole food anti-inflammatory based diet? Are you having your huge variety of color that's needed to keep our gut microbiome happy, that's needed to maintain your own antioxidant defenses? Or are we munching on a largely more refined diet that's not rich in fiber, doesn't have much color? And are we munching our way all around the clock? Because that's another thing that we're not designed to do. We need to have our time to have enough time in the fasted state to be able to activate our own internal antioxidant defenses, to let our gut time to have some rest. So it's just looking about what we eat, how we eat, when we eat. All of this will have an impact on how we set ourselves up in the world. And then the other things, of course, we need to examine is physical activity. It's not about over-exercising and under-exercise. It's about keeping yourself in the Goldilocks zone of what's right for your body and what you're trying to do. But it's about examining, again, what kind of exercise you're doing. Are you hitting all the major targets of making sure you've got enough aerobic, strength and flexibility training? And if you are going to be doing significant training for an event, it's protecting yourself from the things that might be happening. So, for example, marathon or half marathon runners need to look after their guts a lot because they're having a big impact on it by doing really long training runs. And then, of course, sleep and stress management, huge things for us to think about. And again, they can be drivers of anything, including cancer risks. So we know that significant circadian rhythm disruptions can be associated with cancer risk, and shift working patterns have been associated with elevated risk of several cancers. But also, of course, the sleep and our recovery affects our hormone axes. So from our women's health cases perspective, we need to have a look at, are they getting enough sleep to be able to have their adrenal axis working properly? What kind of effect does sleep deprivation have on sex hormones? We know that particularly in males, but actually some effects have been demonstrated in females, that low testosterone is linked to sleep deprivation. So again, looking at how we're going to link that up into the equation. And then stress management, about us being able to not necessarily eliminate stress. It's unrealistic for us to say we're all going to move to Bali and have an awesome life, but how do we actually manage it every day? Can we take a moment to do some breath work? Can we have a moment to do some yoga? If you hate yoga, go for a walk. Can we engage with nature? Can we find some time to connect to ourselves and save others? So it's just about looking at how some of this might play out. And again, trauma is another thing that we see a lot of in clinic, and the way that that plays out in the nervous system is hugely important and needs to be tackled as much as anything else does as well.
Yeah, I can't stop thinking that maybe my testosterone levels are a little bit low right now.
Well, to be honest, at the moment, you probably need your testosterone levels low because you're in the nesting mode with a new baby. So that's okay. I think you'll be fine for the moment.
No, I think that's an amazing overview, though, because as you say, they're all equally important. And I think I sometimes reflect on sort of the industry as a whole and the way social media kind of plays a role in our lives these days, and there is a huge emphasis on the nutritional side of things, at least with what I get exposed to, I guess, in the media. So it is a biased view. But I think, as you say, the trauma element, if there, is such a key part, and our relationship to stress is another big one. And would you agree, Nina, that in regards to stress, I'm always interested in the concept of it's the relationship we have with it, which sometimes just compounds the situation. So like you say, especially as healthcare practitioners, thinking that we should just be in a Zen state 24/7 for our clients. But in reality, there are peaks and troughs in life ultimately.
Absolutely. I think there's this concept of eustress and distress. Okay, so eustress is positive stress, and we need positive stress. Think about exercise. That's positive stress to the body to enable us to go stronger. So, and learning something new, going to university, doing a new degree, converting to become a nutritional therapist is all eustress. It's a necessary positive stress to enable you to grow. But there are times when we do tip over into distress, where we actually become overwhelmed, where it exceeds our coping mechanisms. And for different people, those factors are very different. And so again, we know that there's a different set point when you've had previous significant trauma. Your window of tolerance to stress and to external factors is different to someone else who hasn't been through a traumatic experience. So it's about being mindful of the fact that what might not be difficult to you or overwhelming to you might be extremely overwhelming to your client, and at which point you really need to assess about how to gently expand and support their window of tolerance, and how to give them the coping techniques they need to self-regulate, actually. And sometimes it requires, specific treatment. So with trauma, again, we use, for complex trauma, we use attachment focused EMDR. We refer for that. There's different ways of using trauma, using body-based therapies, of course, using some of the somatic approaches or yoga therapy. So there's a number of different ways of doing it, but I think we've got to acknowledge this very deep interrelation between all the different nodes on the function medicine matrix and all the different physiological system, and understanding that we are an interconnected web of all of this. And as you pull on one thing, whether it is in a positive way or a negative way, you're going to be pulling on the whole network, actually. So it's just about trying to be mindful of the fact it isn't just that one presentation. And like PCOS, people always think, okay, well, it's just insulin resistance, and then you get, elevated androgens, which are male sex hormones, and that's it. Actually, it's a polysystem endocrinopathy. It affects so many other things, actually, and it elevates the risk of multiple different disorders later in life, because if you don't address the underlying physiology, you've missed the point. And that's a bit, I think, that you and I are both passionate about seeing the whole picture and making sure that we've got those foundations in place to support the person, and then deeply individualizing care, making sure that we are targeting things that are specific to that person.
Yeah, I kind of reflected on that quite a lot recently. The general tendency for a lot of us to get sort of hyper focused in certain areas, and I sound like a bit of a broken record with this, but I came across just a beautiful quote recently, which was along the lines of, and it was actually more for psychotherapy, but I think it applies, which was, I think practitioner and patient have to get more comfortable in uncertainty. And I sometimes wonder, obviously there are going to be a whole bunch of different reasons why different people may get particularly focused in this specific area, but I think the idea of control for me sort of resonates. The idea that, well, if it's my diet or if it's XYZ, I can manage that much more easily, and it feels probably a little bit more, we feel more capable to be able to progress if we can sort of overly simplify it. Whereas sometimes I imagine, if we're thinking about the complex web and how interconnected it is, if we don't have someone there to navigate it and fully help us understand, then it probably does feel very overwhelming. So yeah, I'm not sure if that resonates, or if you've had thoughts within that context.
I think you're right. I think there has to be, by necessity, a certain tolerance of uncertainty in complex cases anyway. I mean, ultimately, frankly, in no model will you have enough certainty, and there's no certainty in life, full stop.
Yeah.
But I think that there's a bit about control is a little bit like stress. There's positive control and there's negative control, right? Whereby sometimes when patients, for example, get given a cancer diagnosis, and all of their power at that point can just get taken away, and you get told, that's it, you've got your chemo plan, and oh, what can I do to help myself? Oh, don't worry, we're going to take care of it. You just go home and rest. Now, number one, we know that's not evidence-based advice anyway, in terms of nutrition lifestyle having a significant impact on outcomes. But more than that, imagine you've been told you have a life-threatening diagnosis and that all of that control, you're already out of control, but then you also get told there's nothing you can do to make it better. So that point, actually giving the person some control over this. We can't control our outcomes all the time, no. But yes, absolutely, I can do something positive to help myself by eating well, moving my body, making sure that I'm having deep, fulfilling, connecting relationships, and I have time in nature, and that I'm sleeping well. And that's going to give me that level of not control over the cancer, but control over what I can do to contribute to my own health and well-being. Now, yes, there's then the other way of doing it, which is hyper control, whereby people will tell me, what if I go on holiday and I don't have beautifully filtered water? Or what if I'm gonna, I don't know, eat non-organic fruit and vegetables? And I go, you know what, the body has this amazing internal resilience, whereby no, we don't have to put in a greenhouse and buffer it with lots of cotton wool. We need to get your body strong enough to be able to function in non-ideal situations, because our bodies have that internal resilience, and you have to have trust in your body, and you have to accept that level of uncertainty to be able to say, I trust that my body can handle it. I trust that I've equipped it with enough mechanism and support that it can handle a few weeks of not eating organic or whatever it is that you need to do. So you're right. I think there's this control bit can be good control, where we are viewing it as a positive way of influencing our health and well-being. And then there's the hyper control, the hyper zooming in. Oh no, I'm beating myself up because I had that bit of sugar or whatever else that you've had. There's ultimately, I think, very little that it should be absolute or rigid in people. I think we are all flexible homeostatic systems that shift. And I think it's really important that we are flexible and mindful, because rigidity, I think, creates stress in the body. I mean, ultimately, just think about how you'd feel if you were tensed up, right? Creates stress in the body. So if you, same thing, we can't hold ideas and things very rigidly. And I think that we do. There has to be a level of trust, and there has to be a level of acceptance and tolerance of uncertainty.
Yeah, I couldn't agree more with that. And I can look at my own health journey and think at times how rigidly I was attached to a certain belief or narrative around nutrition, what my diet needs to be like, etc. And looking back at times where maybe for various reasons I was able to kind of relax around that, and the difference it had on my ability to tolerate certain foods, like within a sort of a split second, so to speak, suddenly, because there isn't that rigidity and there isn't, as you say, that tension that you're holding within the body, it can be really, I think, quite life-changing when if we're able to develop, I don't know if this is the right term, it's sort of that meta-awareness ultimately, we're kind of thinking about our thinking. And I definitely, what you say there about feeling safe within our bodies and trusting our bodies for that innate healing capacity, which it does have, it just needs the correct environment for the thing that they might be seeing you for example. But that idea that we can cut our finger and we don't panic, we know that it will heal with time. It might be a little example, but it still applies to some of these more chronic acute situations as well.
Absolutely. And I think the body is always trying to get itself into balance. We know that. I mean, it's ultimately, the goal is survival, right? All of our body's mechanisms are geared towards survival. And in a way is what this is how we've got to remember to detangle some of our automatic responses, right? So things that used to serve us because they might have helped us survive, when we were in a different childhood situation, or when things were different and things were much tougher, might not serve us anymore. And we've got to be able to flex, grow, and evolve. And the whole phenomenon of post-traumatic growth comes into play as well, right? So actually, the fact is that trauma is is what it is, actually. And what we make of it afterwards is really what's down to us getting the right support and treatment, us deciding what we do with this afterwards. We can't change the past, but we can change the way that we relate to the past, and we can change the way that it impacts us on a daily basis. And this is what I'm really passionate about. I think that in my own way, you know, I'm glad that I had something as big as breast that got me off my path, because I was never going to fit in to an environment that was just going to do firefighting, because as a scientist, it just didn't make any sense to me. So from my perspective, I think that while in no way can I say that chemo and surgery was a great ride, I can say that actually, I think what that's helped me do, and how it's helped me reflect, and how it can help me now relate and support the patients that come to see me, is definitely growth and evolution. And I think that we can make all sorts of experiences transformative if we are supported in the right way. It isn't about saying pull yourself out by your bootstraps, because that's not how trauma works. You can't get yourself out by yourself. You need support, you need a community, you need somewhere or someone to be safe enough to be able to help you find your way. But once you do find your way, I think there can be incredible potential for people doing incredible things.
Yeah. And that idea of community, I think, you know, we're all becoming increasingly aware after the last year or so, just the therapeutic value of having a tribe, a community, physical contact, relationships, and how important those are within this kind of interconnected web as well.
Absolutely. And I think it's about also how you create your tribe. You know, sometimes people will say, oh, well, I've got difficult relation with my family. I said, okay, well, they're your family of origin. Fine. Well, let's create another family. Let's think about what interests you've got. Oh, I have an amazing yoga community. Fantastic. They're your Sangha. Well, let's engage with that. So you're absolutely right. I think in general, it's every kind of connectedness. I think we need to think a little bit broader about connecting to safe others, connecting to yourself, and also connecting to the wider world around us in terms of nature connection, as we know also has played a lot of, it's been in the news, because actually for some people it's helped buffer the effects of COVID-related stress, having regular engagement with nature. So it's about just, I think, trying to connect on all the different levels, because we are social animals and we are all an ecosystem, both within ourselves and without ourselves. So it's an important one for us to think about.
Yeah. And that idea of connections come up a lot for me recently. You know, most people or anyone who follows me knows that I'm, how should I put it, an advocate for psychedelic therapy ultimately. And one of the things that they talk about in that is certainly Dr. Rosalind Watts and some of her research about disconnection and depression, and how psychedelics can just act as one of those other tools that really help deepen that connection with ourselves, with others, with nature and the planet as a whole. So I'm a huge believer that this idea of connection, as you say, both within and out, is another just absolutely huge part of it. And I guess the complexities come when, if there is maybe some element of historical trauma, or for other reasons we don't feel safe, then we can get in this really tug of war, I guess, where we kind of know what we want it and we feel like we want to be drawn and need it, but we don't feel safe enough to fully embrace some of that connection. So yeah, it can get challenging.
Yeah, absolutely. But I think it's about using a broad toolkit. It's whatever works for I always say to people, whatever works for you personally, because different things work for different people. It's not about saying, okay, you know what, breath work works for everybody, because it doesn't. There are people who are severely traumatized for whom breath work is incredibly triggering, actually. Right. Because if you try and put them into parasympathetic state when they're always in fight or flight, that shift in state, when done very rapidly, is going to trigger them, because they haven't really felt that way before. And it becomes, again, an unsafe zone. And trying to bring someone to the body when they don't feel safe in their body doesn't work. So again, it's about just having a really expanded toolkit and working with an experienced practitioner for whatever you need to be able to take you through different steps. So I've attended an amazing training for yoga therapy and trauma with Heather Mason at the Minded Institute recently. And we talked about how it's actually about a gentle progression. It's about actually sometimes just about establishing trust by being able to say, I'm going to be here at the same time every day. I'm going to show up, and you're going to know where I am in the room, and you're going to know what's happening every time because I'm going to talk you through it. And I'm not going to force you to put your head down and not being able to look around. And I'm not going to get you to do anything with your body you don't want to get done. And I'm not going to touch you in a way that's uninvited. And I'm going to let you have the control of how much or how little you want to do. So sometimes it's just that simple step. And it's slightly different, but something that came to mind to me just now is that my receptionist used to say, you just make your patients cry. And I said, it's because they haven't really been heard. So a lot of the time I will have an initial 90-minute conversation with someone and they do start crying, because actually sometimes it's just that simple thing of saying, I have been heard, I am seen, I am not dismissed, and my concerns are valid. And sometimes that's the first and the most important step you can give another human being.
Definitely. That's beautifully said.
I think there's so much that we can talk about in functional integrative medicine that's quite complex, and we can bounce around all sorts of biochemical imbalances. But I think what I love about the way that you talk, and certainly the way that we practice at the clinic, is about making sure that on the macro level, the whole person is taken care of. And yes, you do need to zoom into the micro. You do need to sort out what you need about the science and biochemistry and all the other bits and pieces. But I always say that if you just digging around in the detail and you don't see the wood for the trees, you would have missed the plot. You can make the person's biochemistry better, but you haven't made the person better. So that's what we're in the business of doing, right? We are in the business of actually supporting people to heal, to become better, and also to become self-effective in terms of maintaining their own health and well-being, and not become independent on any practitioner, because that's something that we are very passionate about at the clinic. We're not creating people who just keep coming back because they continually need advice. They might need significant advice over a period of 3, 6, 12 months to be able to get them to a point where they feel stable. But after that, I would have hoped they would have learned enough through their journey with us to say, I know what I need to do to keep myself well. I know what my body feels like when it feels well. I know how to self-correct when I go off track. And I also know when I've gone off track enough to require some help to get me back in.
Yeah. And that last point sort of brought up the concept that, and I guess it comes back to some of what we've spoken about, the idea of trust and safety and patience and things like this, which is sometimes I think we can, let's just say, have a little flare in symptoms and panic a little bit and think that we need a new program or we need some sort of significant shift, when
Yes.
I just know through my own health journey that sometimes you can just ride it out and you can change absolutely nothing, and maybe in 2 days, maybe a week, you have self-regulated. Maybe you cancel a couple of commitments just to give yourself a little bit more time to kind of relax. And as you said all along, the body has an ability to come back to a state of harmony if the environment is conducive to that. So again, I think we come back to the same sort of similar concepts of resilience, safety, trust, patience, and connection. And those for me are like the real utter backbones of the human experience to some degree. Um, and yes, we can chat about the specific strain of probiotic or what vitamin A does, and that can be fun as well. But yeah, I think it is very much coming back to that concept of the bigger picture.
Yes, and this is the reason why when I teach as well, so I teach both nutrition medical professionals in integrative and functional medicine and in integrative cancer care, and that's one thing that I'm really passionate about imparting. So when I created the systems approach to cancer course for nutrition professionals, which is a 6 months course, I was very much passionate about not just digging around in detail. We go into the detail of the metabolic pathways and talk all about it, but my first bit about the systems approach is about fostering resilience. It's about fostering good biorhythms, good connectivity, making sure people have some robustness and connection within their life to be able to then take treatment and to be able to do all the other work that you might need to be doing at that point. You might need to be supporting their gut microbiome before the immunotherapy, or you might need to be supporting their hormone levels. So you might need to be doing X, Y, and Z. But to me, you're absolutely right about having those really good core foundations in place and supporting them through the really hard time that someone might be going through, and sometimes building them in for the first time in their lives. Because to me, it's one of those things where you have to treat it as a sign that, no, you haven't been healthy all that time. Sometimes people come to you and go, I've been absolutely fine until I got my cancer diagnosis. And then you take a history and you go, I don't think so, actually, because everything that starts cropping up, and then you go, actually, you've had something wrong in your train or in your physiological systems for quite some time. It's just now that's manifested itself in the full-on cancer diagnosis.
Mm.
And then we have to go, okay, so what were those contributing factors? And how can we manage them? How can we rebuild them? And how can we sometimes put in the stuff like trust, connection, safety for the first time in a very difficult situation? And so, yes, absolutely. I think if we can take the broad picture and the human experience to the core of what we do in healthcare, then I think we can do an amazing job. And never ever forgetting that, alongside having a really good top knowledge of what you're doing in terms of the micro level. So it's not an exclusive thing, but like we know, the macrocosm and microcosms are entirely related, right?
Right.
You can't have one without the other. So it's about just never forgetting to have the ability and the flexibility, like we talked about, to move between the two different views and not hold on to any one particular thing so tightly. Because the danger is as well, if we do too much of the really big picture thinking, we do miss a really obvious diagnosis and a really obvious treatment. So that's another thing about, you can do all sorts of lovely things for someone's psychological well-being, and if you miss the fact that their SIBO is generating half of their anxiety, whoops, that wouldn't be a really good thing for the patient either. So it's about just trying to, I think, to me, about keeping both of those lenses in mind. The macrocosm about what is going on with a human being, what their goals are, what's going on with them physically, emotionally, mentally, spiritually, in whatever way you want to be dealing with that. And then think, okay, right, what are the physiological imbalances? How do they all relate to each other? What are the key pressure points in physiology that I need to address? And then again, zooming back out and go, but by addressing those, have I actually addressed the person?
Yeah. And I think that, however you want to describe it, the macro, the micro, the integrated, the conventional, etc. I don't know about you, and this, I guess, is in some ways a bit of a personal question, but I find that can be quite a battle in my head of like trying to bring these two quite different worlds together, and then understanding it, at what level do we need to pitch this for the person sitting in front of me right now? Because they don't, well, I guess sometimes it sounds like and feels like they interconnect quite nicely, and other times I think they're just going head on against each other.
They do, and you're right. And I think that's part of the art, I guess, the art of healthcare, right? It's about then using your experience of what you think will be most beneficial at that time. So no, say you found 10 different biochemical things you could work on that time, but the patient comes in at that time, day, and they're utterly overwhelmed. They're completely overwhelmed. They can't take on anymore. Am I going to be sitting around fiddling around with those 10 biochemical things? No, I'm going to stabilize the person in front of me, put in some more resilience, build them up, and then we'll tackle them next visit. I mean, unless there's something clinically urgent to do, which obviously we will tackle at that time. But at that point, it just becomes about flexible. But you're right, it's not an easy thing. It's not an easy thing to hold different models in your mind and being able to flip between them. I think I've probably become quite practiced at it because I have to do my job as an integrative medicine doctor from all the different angles. So when someone comes to me with a cancer diagnosis, I have to put my conventional hat on and go, right, what's your treatment plan? Is there any molecular diagnostics that need to be done? What's going on with your blood test? What is the immediate clinical priority, et cetera, et cetera. And then I have to take that hat to the side and go, okay, right. So let's think about the drivers. Let's think about the physiology, and let's think about how we're going to support you with that bit. What's my expanded toolkit? So I think it's just through practice, I've kind of become quite good at putting those hats on and off and making sure that they kind of tally up. But it's not an easy thing at all. I'm completely with you. And sometimes you have to pick your priority and you go, actually, you know what? That model's priority is not a priority right now. We need to leave that to the side and we'll deal with that one later.
Yeah, that's a really good point. The idea of, I guess, sometimes I describe it as we need to put the stabilizers on and let's kind of just get things more stable. Going back to what you commented earlier around, if you've got someone with trauma, bringing them into the body or utilizing the breath might be the last thing that you want to do at that point in time. So yeah, there's a lot of wisdom, experience, intuition that is part of the art side of this as well.
Absolutely. I think also it's just holding some of the general principles in mind. And the first one is the physician's code, right? Do no harm. I always say, like, if you literally have that at the forefront of your mind, you're not going to go far wrong. And the problem is sometimes even in integrative medicine, people just rush in quite enthusiastically and go, oh, I'm going to do a massive 5-hour program for the gut. And the person's on the floor. And I'm going, you know what, giving them really harsh antimicrobial, oh, I'm going to detox you, I'm going to do this or whatever it is. And the person's on the floor. And you're right, it's about building up, putting the stabilizers on, because you cannot necessarily, you can't break a broken system down any further. And when we're doing treatments that are putting a little bit more pressure on the physiology, like say antimicrobials or other things like that, then we've got to have some kind of internal resilience to work with, because otherwise, again, we're all going to end up in a heap. We're never going to get anything done. So this is the reason why we talk about it at the first point of the systems approach to cancer. And we practice that in the clinic. Build first, and then you can do some of the more tricky physiological interventions to get someone to the right place. But yeah, it is about wisdom. I think it's also about learning and getting good mentorship. So I know you guys run the AFMMP. It's about making sure that, again, you engage with the community of your peers and you learn. But also there's also a temptation to just keep learning, right? To just keep going to the next course. I hold my hand up. I'm a serial CPD junkie. So
you're like you're leading this, Nina.
I am leading this. But I think I like to think that I still do try, and the bit that I want to try and encourage people to do is consolidate. It's like the bit that you really want to do is, in among all of my CPD, I try and take time out of clinic to sit down and kind of really let my brain assimilate the different aspects of what I've learned, both clinically, from the educational side, maybe do some blue sky thinking, because I think we need to allow our systems to recalibrate. And that's how I think we get to a new level as a practitioner. And at the same time, the same thing that happens with clients or patients, right? You sometimes build things up a little bit and then you kind of let it sit and reflect and gel together for a bit. And then someone comes in and they've made a breakthrough, right? So it's about also allowing us time, patience, and space for us to be able to reintegrate all the different inputs and come out with something newer and better and more robust and resilient.
Yeah, that is an amazing point, I think, because many of us, including myself, can be guilty of doing a lot of CPD, but not necessarily integrating it, as you say. It's kind of just becomes this knowledge. But how does that fit the model or models that we're using clinically, and how does that integrate into our current knowledge and how we sort of clinically practice? So yeah, I think that is such a key point. And again, a very sort of wise consideration, the idea of taking some time out of clinic to actually do the blue sky thinking and to think about how this all fits in.
Yeah, and I have to confess, I'm an introvert. So I work in a very much, obviously, clinically focused way. I love people, I love helping people, but I'm an introvert. So to be honest, for my own self-preservation, I also need to take time out of clinic and be able to say, I can regenerate myself so then I can be a better clinician. I think particularly when you're passionate about what you do as a clinician, there is a temptation to run away and just do everything. And I'm not immune to that whatsoever. So there's definitely been times where I push myself too hard and I become overwhelmed and I go, hold on a second, this needs to shift. But at that point, it's a good time to reevaluate and say, okay, right, so what's not working? What's pushed us over the edge? How can we prevent it from happening again? so that we don't also burn out as clinicians, because that doesn't work either for anybody. It doesn't work for our clients and it doesn't work for us. So I don't think there's going to be an easy solution. I don't think you can just say to people, oh, just take them out and be fine. But I think it's about just more about thinking, trying to build some time for reflective practice, and trying to build some time to have a break after really busy periods of time, to say, okay, I'm going to let myself have a breather. I'm going to not do all the things that occupy my day, because I think then we get trapped into the same patterns of thinking, right? You know, if you run the clinic day in and day out, you're just going to be in that mindset. So sometimes our best ideas do come from when we go on holiday, or I don't know, go off for a seaside walk when there's nobody around. And we need, I think we do need that time as clinicians, particularly when we pour so much empathy. And I like to think that a good clinician puts something of themselves in everything that they do. And therefore we need to put those pieces back into ourselves, right? Because I don't think that we can function long term without putting something back in. So I think, yeah, I'm still working on it. I'm not saying I'm done in any way, shape or form. There's definitely peaks and troughs in my work, but I think it's just about sometimes having awareness. It's like, I've booked my July out. I'm going, right, okay, this is my time to do my big picture thinking, or have a rest, do my yoga, do lots of fun things that I might not always be able to put into my normal kind of working mother day. But actually we all need that break. And we also need to teach our clients to take that break, right? Because that's, we need to practice what we preach from that perspective.
Yeah, absolutely. And I definitely, you know, we spoke off air at the beginning around being a new parent and some of the challenges that have come from that. And it's definitely been I've been thrown in the deep end in regards to finally setting some boundaries, learning to say no to things, etc. So I'm very much at the beginning of that journey, I think, myself. But going back to one of your analogies earlier, of, you know, the athlete who might be doing some endurance training and how we need to be mindful of the gut, basically. It's the same. You can almost use that analogy again here, which is no professional athlete is just going hell for leather throughout the year. There are micro,
Yes.
meso, macro cycles within their training, the intensity, endurance, etc. of that. And it will be the same, I'm sure, for any field. And it's that idea of eustress, distress, and the idea that we need time to recharge. Probably a really common practical example of that I see is exercise in the general public, and how that's not, no one's really encouraging them to tweak that based on what else is going on in their lives.
Yes.
So, you know, if you've got a big deadline at work, it may be that you're working longer hours, there's more stress, and maybe as a result we do need to back off with the stress that you're getting from your exercise or whatever it may be. So I love this idea of just dials that we're constantly tweaking each one of based on what's going on.
Yes, absolutely. Well, I talk about the total bucket. So I always say that you've got a total load effectively, and ultimately your total bucket is composed of various kinds of load. It's your physical stresses, your emotional stresses, your mental stresses, whatever else is going on. So social stresses would be another part of it, but ultimately all goes into one bucket. So there's only so much capacity within that. So if you've got a lot of social stress going on, a lot of emotional stress going on, you know what, we can't put a lot of physical stress on top of all of that. So you're absolutely right. I think it is really important that people realize that. And we particularly see that in some of our patients with very fragile nervous systems. So where things have become so dysregulated, there's actually relatively little normal capacity to be able to bring yourself back into balance. So sometimes with things like functional neurological disorders, or again, complex trauma, there's that, you don't have that ability to be able to regulate homeostatically as well. And that means that people need to become almost hyper aware for a short period of time about their total bucket, and become very vigilant, and become really good about saying no, and about saying that actually, if I'm going to have a big consultation with someone that day, I need to rest, and I need to not be having, I don't know, massive discussions with my friends about something else. So that we really need to manage that, and we need to pace ourselves. And then as recovery occurs, and again, your world becomes bigger, your resilience becomes stronger, your ability to self-regulate becomes better. So, but I think you're absolutely right. We need to be aware of the concept of the total bucket. And if you are kind of sleep deprived or fatigued when you have a baby, probably not the best idea to try and go and train for a half marathon or something. I'm not sure you're thinking of that, but
Yeah, I'm definitely not training for half.
No,
Yeah,
but you're right. I think it's so easy also for us to sometimes, in the society that rewards this overwork and sort of overdoing things and probably excess in very many ways, we don't get encouraged to reflect on the fact that if our workload is incredibly high during the week, then we probably don't want a packed social schedule every weekend, because guess where that's going to land us? In burnout.
yeah,
Because actually we need to have some kind of downtime. And someone said that to me, actually, we were talking about kind of, I guess, sort of returning back to some kind of normality post the pandemic and seeing what happens. And I said, just think about what you want to pick back up, because we don't have to pick all of the whole thing back up again. We actually get an opportunity, a fairly rare opportunity, to reflect on how much we really truly want to re-engage with what we lived like before. So which habits do you want, and which habits are you actually quite happy to give up for now? So if you used to have packed Saturday mornings that, particularly with kids, sometimes, again, this is what happens when they start getting older and you have clubs or various bits and pieces and activities to go to. If you had a packed Saturday morning, it used to stress you out after a really packed working week. Do you need it? Or would you actually benefit from a time spent a Saturday morning, I don't know, cooking with your children, reading with your children, just bobbing around in the garden, whatever it is that suits you better? Would that offload your load and make you feel like you're a better parent, and actually make you feel more ready for your Monday coming soon? So I think it's just about, if we're conscious of it, if we live our lives a bit more consciously about how much we take on, I think we can benefit ourselves and our loved ones to a significant degree.
yeah. And I mean, that's a huge conversation that we could go into, I think, the whole which I'm mindful of times we won't, but it does show us the complexities of this. Because the one thing I will mention there is, I guess, the idea of, how our personalities influence some of that decision making as well. So healthcare providers being real helpers, and sometimes overcrossing our boundaries to help others. And that's why so many of us kind of have flirted with burnout before, or we are. So, so yeah, I think that's a really big one. And again, like you being an introvert, we've had some weekend commitments, and 3 in a row now. And waking up Monday, I was aware that I really had to prioritize self-care to try and just get some degree of recharge back in. So again, that awareness of who we are, what we need, and to adapt is such a key part of that healing process.
Yeah, absolutely. And I couldn't be more delighted when last weekend my husband said, oh, okay, well, I'm allowed to go and visit my mum. So he took my daughter off for a visit to nanny. And I was like, oh my goodness, I have a house to myself. Oh my goodness, I could not be more excited, even though all I had to do was basically write lectures, go for a walk, and hang out in my own house. But I was like, this is amazing. This is fantastic. I get to be by myself with nobody poking me. It's fantastic. So yeah, I think it's just, I guess it's a simple thing. It doesn't really need to be very complicated either. It's just sometimes the simplest things can give you so much joy if you're aware of what is right for you. So to me, sometimes being by myself in the house with a book, that's it. That gives me great pleasure.
Yeah, it kind of comes back to those, I guess, needs. What are our needs, and are they being met? Are we meeting them, or others meeting them, etc.? That's something I've been really reflecting on recently as well. Kind of how that then, I guess, overlaps into kind of health and behaviors.
Yeah, well, also parenting, you're right smack in the middle of needs and the whole complex interplay when it's not just all about your needs anymore.
Yeah,
And it's actually then becomes a big dynamic between your needs, your partner's needs, your baby's needs,
yeah,
your client slash business slash career needs, and it becomes a fun party. So it's
yeah.
definitely something to figure out dynamically.
Yeah, and I guess it's at the moment for me the perfect sort of example of everything we've been discussing about, really, including sometimes the idea of it will pass. It's not forever, and
Yeah.
sometimes reminding ourselves of that it will pass, and that it's not necessarily fixed in stone. It's kind of how can we navigate through it to the next chapter.
Yeah.
So yeah,
And then having something to look forward to, I always think that's quite a nice thing to do as well. I think, like, whether you've got a built-in break, or whether, like you said, you're using that positive concept of positive stress, that actually it does have an expiration date, that you're not going to be feeling as tired all the time, or you're not going to be up as much in the night, or whatever it is you've got going on. I think having an idea of the fact that it will pass, and that also there might be other things that you can do to support yourself while it does go on, and then try and schedule in either a break or something else to look forward to, because I think as humans we are quite forward driven anyway, right? We're quite future focused. Not that we do have some past orientation, often quite negatively biased because we need to learn from our mistakes, but we do have quite a future orientation. So if we can build the future orientation to be positive and to have that expectation of good things, and I think that can help us massively through some tough times, whether it is new baby sleep deprivation or whatever else we've got going on.
Yeah, absolutely. It's so true. I think, coming back to our inner dialogue and how we're framing things can be a massive one. Nina, I'm mindful of your time. We've hit a magic hour point roughly, which is amazing.
Well, it's a perfect time, isn't it? We actually came to a natural pause, and I think we've covered quite a whole gamut of things.
Yeah, I might have to re-listen to this before I record the introduction to the episode to remind myself how much it's been covered.
You'd be like, hold on a second, what did we actually talk about? Basically everything.
No,
it's a bit like Big Bryson, the theory of everything, that kind of.
It's been incredible. I think it's such an important message to help people see the bigger picture, the interconnected web, and how we have to mirror that with some of the more microscopic elements that obviously, as you say, have their place as well. And it's just a constant juggle of deciding moment by moment what is the most important thing. As you say, how's the client feeling and what's their week been coming into your clinic, and that's going to have an impact on what actually you do with them. We can all take that away and use it on ourselves day to day as well.
I think it's about having that flexibility. Like you're saying, we're trying to build more kind of flexibility into what the client's physiology might be. We have to be flexible in of ourselves. That's why, there's sound bites that go around in functional medicine, integrative medicine. This is the way. And I'm going, nah. Mainly because anytime anybody says this is the only way, I go, this just turned me off massively, because I can tell you there is nothing absolute in physiology, and there is nothing absolute in the human experience. There will always be exceptions, etc., etc. So I kind of think that generally, if we are working flexibly and if we work in putting our patients in the center of it all, then I think we can't go far wrong, really.
Yeah, no, 100%. I think I would say more times than not, there's more than one way to heal, fundamentally.
100%.
There's dozens and dozens in
yes,
each
there's lots. People
Yeah.
sometimes say to me, okay, I've got eczema, what can I do? I'm like, well, you can go and see a number of different people actually, and you probably get the same result. You can come and see, a nutritional therapist who's practicing functional medicine model. You can go and see a herbalist, and they can still give you excellent results. Medical herbalists are fantastic with eczema. You can go and see someone else. I don't know what, but it's not about trying to also be all things to all people. I think that's another thing that, like, we sometimes, particularly when we are experienced and when we've done a lot of complex cases, we can hold ourselves a bit like, I must be able to help that person. But I say to people, I can't help everyone. There may be a clash between our personality, the way we do things. There might be a fundamental mismatch between your expectation of what I can deliver and the reality of life, which sometimes definitely doesn't meet expectations. So it's about and saying sometimes, sometimes actually that exceeds my expertise, which, while considerable, will not ever cover everything in human biology and human health. So you kind of have to, I think, also stay reflective of that bit, because there is a temptation of just keeping going. And I kind of go, actually, there are sometimes when it's time to let go, and actually go, I've reached what I can do, and maybe you're better off seeing X, Y, and Z, or maybe you need to do something else before you're ready to come back and do this kind of work, like, with trauma or with other things like that. When you meet someone who's really, really resistant, who's got all of their barriers up, and you kind of go, no matter what I do with you, it's not going to be enough, or everything always fails me. And I'm like, again, no matter what I do, it won't be enough. So let's see what we can do in terms of changing that attitude, and then we're going to get somewhere. But I think there's a lot about like the expectation to still be fixed in that way, right?
Yeah, definitely. I think that the concept of expectations for me is a massive topic that I've discussed with colleagues, kind of not on the podcast, but just, you know, over a beer or a glass of wine or something, because it is a big one. You know,
Yeah.
it's such a different model to the conventional one. And if people don't know that, there's going to be a huge clash in kind of expectations. Yeah, definitely.
It's quite like, just give me a pill. I'm like, no. Like,
Yeah,
or people say to you, going, what supplements should I have? I'm like, no, no, let me tell you about how we're going to work on your lifestyle first, and then we can think about what supplements you might want to have.
yeah,
But it's about like, you can't out supplement terrible lifestyle. You just can't. And it's not just about diet. People say you can't out supplement a bad diet. I'm like, but that's just taking one portion of it out, right? We said that nutrition focus, everything about nutrition. But we both met people who have perfect nutrition and are still very sick
yeah.
because the rest of what's going on with them is not in any way okay.
Mm.
But they're just so focused on the lifestyle and they have this perfect anti-inflammatory diet, very boundary, blah, blah, blah. And so you're going, but that's not where the root is then, is there? There's other things that are going on. And they're like, well, I do have the perfect lifestyle. But I'm like, yeah, but other influences in your health and well-being.
Yeah, it is interesting. And I think that one of the challenges definitely is kind of having, I think, the compassion for ourselves, that to be aware that we all have massive blind spots, no matter where we really are in our journeys. And I think sometimes it's maybe we're seeing a practitioner and the blind spot is the barrier ultimately at that point in time. It's definitely something I've been, I guess, developing my own awareness of recently. And I definitely believe in the concept that life is often a mirror, and, you know, we are ultimately projecting our own stuff into situations. So whatever's triggering us, there's some really uncomfortable reflection that can be done in regards to, okay, what is the kind of the message here, and how am I involved within this sort of response? So yeah, you know, sometimes there's a lot of soul work to do as well.
Yeah, absolutely. I think there's also sometimes where I think the multidisciplinary team really helps us cover our blind spots, because, you know, I will say to people, like, if you want proper advice on MSK issues, you do not come and see me. You come and see my physio. She is the MSK guru. I know basic kind of medicine or functional medicine about MSK stuff. I am not an MSK specialist. But you want to come and see her, and she will give you the full diagnosis, the full workup. She'll do your medical acupuncture. She will do whatever she needs to do. But it's about, I think, to me also, this is the reason why I was really wanted to create a team, because to me, I'm like, not only do they back up the expertise, but also if you are missing something and you do have a blind spot, then having someone say, oh, have you thought of X?
Yeah.
And sometimes be just a really invaluable tool, because we all have well-trodden neural pathways in our brain that we go down, right? And then we go, whoosh, and off with the fairies. We go, oh, okay, I've arrived at this destination. And then you go, and then the other person goes, but you missed the turning over there. So it's quite nice to actually have that bit of reflection and bouncing ideas around, which is really good.
Yeah, going back to your point around sort of mentorship, because we get,
huge
as practitioners, we definitely get in our own ruts in regards to how we do things, how we think about things, and stuff like this. So yeah.
And it's like there's this obviously faulty assumption that because it's worked for X and Y and a Z, is going to work for A, and that's just not true. So that's a bit where I think sometimes you need to have those, like I said, the almost reflective mirrors of saying, have you thought of that? Or sometimes reflecting the case back to you in a mentorship, and you go, I didn't realize I kind of went off down that particular one goat track when actually I should have been thinking about X, Y, and Z. Yeah. So yeah, I think mentorship is a huge part of it. I think that just community and the talk that needs to happen. And to be honest, that's something I'm missing, I think, in the UK at the moment. We're missing probably the big high level dialogue that needs to happen within kind of functional integrative medicine, within people who are kind of really experienced in the area, who, when we struggle, we don't have anywhere else to go. So like, I have a couple of people like in the US or other places where I can go to, but actually most of the time it's a little bit like when you reach a certain point of experience and when you've done all the massive CPDs, etc., you're kind of going, okay, right, so who do I talk to now? And you can't call up the supplement company because you know more than them. You can't call up the testing company because you know more than them. And you go, right, so what do I do now? And that's when I think we really need to have the different levels of, I think, not just mentorship, but also just general multidisciplinary and I guess sort of peer-to-peer discussion, which I think at the moment is missing in the UK. I think we're not really communicating in that at the high level. I know there's been kind of some kind of cross-doctor things, but again, they're quite. So Indra set up a meeting for doctors in functional integrative medicine, but again, like that's to me, that's not denigrating anything, but I'm just saying that's quite low level. That's entry level stuff. That's people who've done AFMCP. Right. I mean, this is really not where we are swimming in that world. We kind of, that's great, and they need to have mentorship at that level, but we kind of need, I think, a cross-professional group at IFMCP plus level, where I think that if we do get stuck, we're not going to have to explain what Akkermansia does or blah, blah, blah. You just go, blah, here's my case. Here's everything, all the really complicated crap that I've done. Now, what am I missing, people? That's really, I think, what we need, because I think we do need that. I think otherwise it becomes a bit of a lonely part. And even if you've got, obviously you're in the practice, I'm in a practice, it's still just good to get that global view. I think it would serve us really well. And I think we're too dependent on the US at the moment for functional medicine. We really need to become self-sufficient as a country for doing things like that ourselves. Massively. Yeah, I need to add that to my to-do list.
I was about to say, your next project, Nina, is...
My next project is the Academy for Functional Integrative Medicine UK. Okay. I'll put it on the list for 2022. Fab. Anyway, lovely to speak to you, Alex. Thank you so much for having me, and hopefully it's been a useful, even if very broad spectrum discussion.
Absolutely. Thank you so much.
Bye.
Bye.